glad to have everybody back here again here at the end of October. We had purposely kind of pushed this out in the schedule because we knew early in the month we had some kind of important conversations going on with some of the organizations in town in October. So we're going to spend a lot of time today actually just getting some updates from folks. So, Jason, did you have anything else before we started? Or we can launch right in?
I do not. I think you hit it.
Well, Julie Gibbs from Riley County Health Department, do you want to start us today?
Yes, good afternoon. I just have a quick update as far as COVID. I'm going to start with numbers. Our release came out yesterday. So as of yesterday, we had 38 total new cases and 54 new recoveries since last week. That brings us to 92 active cases that we are monitoring. Last week, our percent positive was 3.17%. That's down from 3.3% where we were the week prior. And that gives us a 14-day average percent positive of 3.24%. Bob can give a better update for today, but as of yesterday, we had 4 COVID positive patients being cared for at the hospital, 3 in the ICU, and all but 1 were unvaccinated. Our testing numbers have gone down. The demand's gone down quite a bit. Last week, we performed a little over 1,300 tests. And to put that into perspective, just a few weeks ago, we had about 2,000 tests that we were doing per week here in the county. We are testing daily for those who are symptomatic here at the health department. So they just need to call that screening line and we can get them tested with our rapid tests. We have partnered with KDHE, so they are doing PCR testing at the mall. So they do have the saliva kits available for asymptomatic or symptomatic individuals at the mall every weekday from 8 to 5. And our RADx team has been going out to some of the smaller communities outside of Manhattan to offer testing there. So we encourage people to check our Facebook page and our website as far as their schedule as that changes weekly. We are offering saliva PCR and rapid tests at the health department on Saturdays for free and no appointment necessary for that. They're instructed to park behind the health department on Wharton Manor in the designated spots, and we can go out and get them tested. That's every Saturday from 9 until noon. And along with that, some more schools are signing up with KDHE to be able to do testing in the schools. USD 383 was the first to do that. We're still waiting on a CLIA waiver for Riley schools, but they will soon be on board as well as MCS. So they'll be able to do testing there at their schools, and they'll have all the supplies to do that through KDHE. As far as vaccinations, we have dates set up for booster clinics. We are completely full for tomorrow's booster clinic, our Moderna booster clinic. We'll be servicing about 700 people tomorrow. That will be at the Family and Child Resource Center in our West End conference room. We did 414 last Friday and the process went very smooth. So we hope it will be the same tomorrow. We have another clinic scheduled for Monday, November 1st, Friday, November 5th, and the following Monday, November 8th. I just checked with our IT and we have around 100 signed up for each of those dates so far. If the demand increases, we will increase the booster clinics, but as of right now, that's what we have scheduled. We're also working with USD 383 to go ahead and schedule clinics for when it is approved for kids 5 to 11. We know that will be coming out as early as next week. And so once that is approved, we can go ahead and move forward with those clinics. We have scheduled 2 Saturdays, one on November 13th and one on December 4th. Same location at the West End conference room at the Family and Child Resource Center. And we'll, of course, add more clinics as we go. And that's about all I had. Any questions?
Hi, Julie.
Hi.
So the booster shots are only going to be given at the health department. Is that correct?
They're elsewhere as well. We know I just learned that Stone Creek is offering a drive-through clinic for their patients, I believe, this Saturday. But I know that places like Hy-Vee and Walgreens and those other places will be offering the boosters as well.
And is that going to be, Moderna, or is it going to be any of the other any of the other vaccines out there? Or is it just going to be Moderna?
We have Moderna available just for our clinics, but you can mix and match. So those individuals who had Pfizer for the first series or Johnson & Johnson, they can go ahead and get that Moderna booster, but that's what we'll have available at our clinics.
Okay. Thank you.
Mm-hmm.
And by the way, Julie, since nobody else is going to talk, you have done a phenomenal job this past year. I just want to high five you, girl. Thank you for sticking with us. You know, that was some real chaos going on there for a little while. And I just want to give you a high five and just say my sincere thanks, you know, for keeping us all kind of pulled together, because I'm sure it was pretty freaking hairy there for a little bit. So thank you.
Thank you. I appreciate that.
Good comment. Well, I will introduce our co-chair to make a few comments. Bob, do you want to touch base on what's going on at Via Christi?
Sure. So as Julie said, we actually started our day with 4 positives. One of those was on our medical unit, the other 3 in the ICU. Today's not been such a good day. We actually have 2 more people in the ED right now who are most likely going to get admitted, and 2 of the 3 patients are actually now on ventilators. So everybody's kind of gotten worse today. Our ICU actually is completely full, all 8 beds, obviously with lots of non-COVID patients as well. Transfers are probably still the biggest kind of problematic situation that we're seeing across the state, and certainly in our part of the state. So yes, sometimes we've had to just be patient. We are boarding patients sometimes for hours or more till we can get them transferred to another facility. And the ED volume, just the outpatients that come in, because Julie's team actually in the primary care docs probably doing most of the testing in the community. We do a handful a day, and it's anywhere from 0 to 4 positives that we see coming through the ED. And I think Stone Creek, K-Stat, Health Department, everybody kind of is continuing to see the little numbers of positives. I know K-State has seen a little bit of an uptick in their positive testing, but it's still not, I mean, we're talking less than a couple of dozen. So it's not like huge, terrible numbers. It's just that they have seen a positive. I don't know if Linda, if you've got Kyle's more up-to-date data. One thing I would just mention, because we actually have some families with us right now with their loved ones that we're caring for. I do think there's this huge misconception around the financing of COVID, because these families actually believe the federal government was paying for all the cost of COVID healthcare. And that actually is not true. The government has done a great job, I think, of funding the testing side of things. That's what's allowed us to continue to have testing, for example, at the Dillage parking lot. And certainly has helped with the vaccine, just making sure that we have vaccine in our country that is paid for and that people are able to get that at no cost. But other healthcare, like if you have to go to the physician office, you have to get testing done, you have to be hospitalized, that is still back on the patient, their respective insurance, et cetera. So I thought that was just kind of interesting that it continues to kind of bubble up when we're 20 months into this. So thought I'd maybe clarify that today. Any questions about? Okay, thanks, Jason.
I will say, and I'm not going to say who, but I mean, I called my pharmacy and I got an appointment fairly easily to get a booster. So I think it's fairly, and they had both of them, right? They had Moderna and Pfizer. So I think that if you want a booster, they're fairly easy to get at this point.
We actually have a lot of access points across kind of our 3 counties, Gary, Potawatomi, and Riley. We actually have a lot of access points for people to take advantage of. The only thing that is a little more difficult to find is the Johnson & Johnson vaccine, if that's what people are looking for. And that is just because the state of Kansas has actually not been allocated like huge numbers of the J&J vaccine. This goes back to the beginning. We've just never gotten a lot of that in our state. And so Moderna and Pfizer have been the products we've been using because that's what's been available to us.
And I got the Johnson & Johnson, but my understanding is you can get a booster from any, if I have the Johnson & Johnson, I can get a Moderna booster or a Pfizer booster. correct? Okay.
Yeah, there's actually been some studies that have shown if you had Johnson & Johnson as your initial dose, you actually get better protection if you get a different vaccine. You're better off to get Moderna than actually a second dose of Johnson & Johnson.
So
Linda,
Bob,
did
I'm kind of curious, because you mentioned about healthcare cost. And so I guess, I know that I had kind of raised this in the past, about what kind of cost, hospitalizations, were. So I just want to clarify that insurance companies, if you have insurance, they are covering you. However, there is no supplemental insurance that is coming in from any other entity, such as, the feds or the state or anything of that nature. Is that correct?
not to any patients and not to any of the insurance companies that I'm aware of either. And so, yeah, whatever your copay, deductible, depending on your plan, that would still actually be the person's responsibility.
Okay, thank you.
And that's true through the whole continuum. That's seeing a physician office visit, that's getting an x-ray, that's getting a hospital or ICU stay. It kind of all works the same. Linda, did you want to go next and give some updates from K-State?
Yeah, like you were saying, our positivity rates on testing did go up a little bit. Say 2 weeks ago, we were at about a 1.17% positive cases. We tested 429, had 5 positive cases out of it. Then this more recent, the past week, we had 453 tested with 11 positives. That put us at a 2.43% positive. So not where we were last summer, but it did go up a little bit. And as far as like quarantine, our numbers are still pretty low on that. We have 8 in quarantine and 11 in isolation. And of course, they're constantly moving out of that. So we still have our mask requirement in place for when you're indoors on campus, and we're using the CDC guidance on that. And when Riley County gets below the substantial category, say the moderate and lower, for 2 consistent consecutive weeks, then we will lift the mask. Then if it does go back up again into the substantial or high risk, for 2 consecutive weeks, we would put the mask requirement back in. So I know everybody's asking about basketball, but we need to wait and see what's happening at that time in that large indoor space. But right now we're still continuing with the mask requirement indoors. Say like if you would go to McCain right now for one of the performances, you'd be wearing the masks when you're in there for the performance. But we'll watch the CDC guidance on the positivity or the transmission rates. We also, we're part of the, the federal requirement for mandating vaccines because of our federal contracts. So we're working through that now and highly encouraging the vaccinations and working towards the deadlines that have been set by the federal government related to vaccine requirements for employees. And that would be faculty, staff, and student employees. So that's keeping us busy right now. Any questions? All right, thanks.
Thanks, Linda. Carla, you want to give a USD 383 update?
I sure can. Can you guys hear me okay? I'm hanging out at Flight Crew Coffee. Can you hear me? Yep, Gina's like, yep, I hear you. So for USD 383, next week will be a big change for us at our high school classes. We made the decision last week to go ahead with our high school population only because they are the group that has had access to vaccinations for the longest time. Our middle schools, the 6th graders don't reach that age cutoff, or not all of them reach that age cutoff to have vaccinations available to them. So we are going to permit masks to be optional starting next week, November 1st through the 19th. That's the 3 weeks leading up to Thanksgiving break. We are definitely going to keep a very close eye on what that does to our quarantines, obviously our positivity. We are in a good spot. Our data dashboard that was released yesterday looked good for us. And we are doing better as a community. And that was a decision that was supported by the medical advisory committee that we've been working with, the health department, and then what brought to us by the administration and then approved by the board. So that's kind of our first step, knowing at the same time that we always have the ability to pivot quickly and reverse and put mitigation efforts back in place. I think that our communications team and our nurse Mindy Sturm in particular did a great job this week of producing a video and releasing it on Facebook that shows all the different testing options that are available. She actually did a test or showed how you would do a test on students under those three different conditions that the schools can do testing. Physically showed what that testing looks like, which I think is nice because it hopefully will dispel the concern that it's the way up into your brain test. It's the front of your nose test. And she talked about, what circumstances would we use this test and how does it look? And then at the very end, it was interesting. She showed how you read those tests or what happens after they take that swab. So if anybody's interested, it was a great short video that I think was just really some good public information to help us understand what happens with those tests once the medical providers do it. That's happening on those two ends. I'm always going to say we need more people, we need more staff. We're always hiring. So if, again, you guys have networks in the community for people who are looking for jobs, we need them. We are preparing actively to welcome our students that are going to be coming to us from Afghanistan. That's well underway. And I think the last thing that I would want to talk about is a little bit more in the touchy-feely range of things that I've hit sometimes. And that's that I have heard, and many of us have heard overwhelmingly from our teachers this year, that the students, as they're coming back into school this year, it's not like the old days for anybody. It's not been easy. There definitely have kids who are coming in and just showing us through their behaviors that they're struggling. Our teachers are very much, even though we're all in person, that's wonderful and we enjoy that, we want that. Kids are doing really well with masks. Kids are doing well in those regards. Our teachers are having to spend a lot of time working on just that self-regulation and getting students into a place where they're ready to learn. So we're definitely feeling the crunch of that. Our teachers are really good at what they do and they're great educators and they're really caring people. So this really touches their heart strings 100%. So if you know a teacher, if you see a teacher, please encourage them. We're not in that same level of stress as we were last year with hybrid, but I definitely think the stress level, it's a different type of stress, but it's high right now for our staff. They're very, they're tired. So absolutely, if you have any words of encouragement for them, please share those. And I'm happy to take any questions.
Yeah, very good. Thank you, Carla. Evan, do you want to kind of bring us up to date on things at Fort Riley?
Yeah, my name is Evan Preparis. I'm the engagements officer for Fort Riley here. So by following the protocols that the senior commander put in place with the Department of Defense's vaccine mandate for soldiers, civilians, employees, and contract employees, we made good progress in reducing the community transmission rates here on Fort Riley. We've focused a lot on risk mitigation. One of the examples has to do with our fitness centers, right? So we have 6 fitness centers on post. 4 of those fitness centers are now being restricted to vaccinated patrons only. Then the other 2 centers were able to implement this a couple weeks ago. Unvaccinated and mixed status patrons can still attend those other 2 fitness centers. Vaccinating soldiers and civilians against COVID-19 is the primary means to end the serious illness, we believe, here at Fort Riley. And it's also the means to reduce hospitalizations and death from the coronavirus and to enhance the protection of our soldiers, civilians, communities, and our nation. We continue to offer vaccines, and I want to applaud the efforts of Irwin Army Community Hospital and the teams who have diligently provided vaccinations to the Fort Riley community since December of 2020. We remain under the policy since July 29th, in which the division commander, Major General Sims, following DoD policy, reinstituted mask requirements in all buildings on post. You can see I'm in an office by myself, so I don't have a mask on right now. We're still keeping facilities open, but we are required to wear masks indoors. We're confident the people of Fort Riley and our entire region will take the right steps to protect themselves and others as we move into this holiday season. If you want to know more about the details about COVID-19 mitigation here on Fort Riley, what's fully open, what has limited services, and our coronavirus information, it's all up on our official website. So you can head over to that at home.army.mil/Riley, and you'll find a link with the latest coronavirus information right there on the front landing page there. Major General Sims' most recent letter and general order, which was updated July 29th, are posted there too, along with a list of facilities and any restrictions or limits, links to Kansas Department of Health and Environment, and the Center for Disease Control. Pending your questions, that's it from Fort Riley.
Thank you, Major. So we actually have just some times for other updates from members of the groups. I don't know if either downtown business, Dennis, if you guys have anything you'd want to kind of catch us up on.
Hi, can you guys hear me?
Yep, you're good, Gina.
I can give you a little bit of an economic update. We're proceeding full steam ahead with our usual fall and holiday events. In fact, we've added more events due to patron demand and desires. We've only got 1, maybe 2 businesses that I'm aware of in downtown that require masks upon entering. Other than that, I think most are really sort of taking the position that business is back to normal for the most part. Our sales tax receipts are going up, so this is a really good sign. We had a ticketed event 2 weeks ago that sold out, which was also another great sign that people are returning to business as usual and want to be out and about. These are, for the most part, outdoor events, so we'll be limited here on what we can do in late fall and winter time. But yeah, for the most part, it's been really, really nice to see that what I think is stepping full on into economic recovery. That's not to say that we don't anticipate another wave behind this, but certainly feeling much better than we were this time last year. So that's what I have. If you have any questions, be happy to answer them.
Dennis, were you going to say something?
Yeah, I just wanted to give you all a brief update. It's good to see everyone. As of 30 minutes ago, we didn't have any employees who are active COVID patients. As far as I know, we haven't had any in a while. Same goes for the inmates in the jail. I received an inquiry from an employee last week about the December 8th deadline of President Biden on mandatory vaccines. We consulted the White House website and the criteria listed there, and we don't believe that we are subject to that requirement. So in my messaging back to all of the employees, I indicated that I don't believe we fall under that mandate. And as I always do, whenever I message about COVID, I always encourage my employees to consult the personal physician or other medical staff about whether or not the vaccine is for them or not, and to make that decision on their own. We don't have a mask mandate inside the building or in our patrol cars either. Lastly, nothing's come to my attention in probably several months now about any significant disputes out in the community that we've been called to where a mask is required and someone is refusing and a conflict has occurred or a crime has occurred. So that's good news. That's good news that people are respecting those, as Gina mentioned, who require masks in their businesses, and folks that go in are respecting that. And as far as I can tell, things are going well. Similar to what Carla said, and I heard Eric Reed say this last week on the Monday on the intergovernmental meeting. You know, I've noticed some behaviors also that when we notice it, we address it with our employees and try to direct them to peer support or EAP or other assistance if we think that they're struggling in any way. So we're continuing to monitor that, and hopefully the services that you all are seeing look the same. I'll take any questions you might have. Thank you.
Bob, I might just share some of the City of Manhattan updates that we did. And let me share my screen here. Can y'all see that? So similar to K-State, we had been kind of tracking the CDC website, but we found more often than not didn't jive with our Riley County data. So I've been plotting new cases, percent positive, those hospitalized, or increases in hospitalization, and Julie's crew also reports on, you know, the new variants and how many of the new variants. And so this is the blue line, the big line here is the number of new cases. And then around the first week of August, when the variant started spreading more, we went ahead and put in a mask mandate for our own employees to wear on indoor, and then also for anybody visiting our facilities or doing business in our facilities indoor. So we've been tracking that. Obviously, the cases have been going down. The variant's been a little bit more erratic, but it's been trending down also. And then I've got another graph where I've blown up the hospitalizations and percent positive. So the blue line is the percent positive. This is tracking since the first part of July. So it's come down nicely over time. And then our hospital rates, and certainly Bob can speak to that, but they've been up and down too, but they've been trending down a little bit. So, you know, one of the things that we did initially for our policy was we wanted to protect our workforce. And so with originally we were working on a policy that provided those that were vaccinated weren't going to have to wear masks. And then the CDC study came out and said, well, even if you've been vaccinated, you can still spread the variant, and the breakthroughs were happening. And so that's when we went ahead and just adopted the full measure. But I've suspended that policy for now, and we're not requiring, but we are strongly encouraging masks still in our facilities, and a lot of our folks continue to wear them. And that's going to be kind of where we're at going forward. So happy to take any questions.
I don't necessarily have a question, Ron, but just an observation. I think you've put together the right set of metrics and numbers, even if they're not completely consistent, to make an advocate for a proper policy using some guidelines that I think the rest of us aren't. So I think when we look at some of those things that we need to do, the graph might be a good place to start. So I just wanted to compliment you on that.
Thanks, John. The other thing that we had when we instituted, we did have some impacts to some of our working units. A couple of our divisions had employees that were pretty well impacted. So, you know, and I got a lot of calls from pickleball players that didn't like having to wear a mask in the rec center. And I said, well, if you want to keep that rec center open, you need to keep wearing that mask, because if all my staff are quarantined or test positive, I'm going to have to close it. So that was another perspective about it, and still, certainly trying to take the pressure off our healthcare workers as much as we could was a goal as well. But hopefully this trend will continue, especially glad to see it. It would appear at least that the variant's calming down a little bit, and at least no initial new variant that's taking hold and spreading. So it'll certainly be an interesting regular flu season, and certainly encouraging folks to get those vaccines as well. And appreciate the comment about because I've heard both that it may be better to get a different booster than what you had originally. So I hadn't heard that. I had heard that still they indicated you need to get the same one. I think that was based on the 2-shot method though. So that's good information to have. Thanks.
I think again, over the next 3 or 4 months, we'll even have more. I think there's so much of what we've learned in the last even 3 or 4 weeks about mixing and matching. You give us another 3 or 4 months, then we're going to have a lot more data about that too, versus just the clinical trial studies, because we'll have a lot more just actual population that can be looked at. Anybody else stay?
I'll jump in and just give a quick update. I appreciate everyone's efforts as we have navigated through these very interesting times. We're always interested in how well our visitors coming into our community, and I reported to the City Commission the other evening that through September year to date, we're running at about 52.4% occupancy. It's still down anywhere from 12 to 15% less than where we were prior to the pandemic. But what we are seeing is that leisure travel being the one that has bounced back quicker than that of meetings, and it just validates what we have all been sharing with just being cautious as we come back. We are excited, and certainly Gina and with downtown and Aggieville, as we move forward into the holiday season. We have a campaign going on called the Spirit of the Holidays, where we are tying all of the holiday events together and enticing visitors to come in and shop to help with our just getting our community back as to where we are. The holidays really start in full fever with in November, the first part of November, and certainly we really then with the lighting of the tree on the Friday after Thanksgiving is when lots and lots and lots of activities take into effect. So again, kudos to each and every one of you, what you have done in order to keep our community as safe as we possibly can.
Hey, Jason, this is my chamber hat on. Could you maybe just give a quick comment or two about the sales tax trends that we're seeing?
Well, I might ask Ron to do that because they get those in
before you do.
Yeah, and report them out.
So we did receive our October sales report, and we haven't got the breakdown out publicly yet, but it's been holding steady. It was not quite as strong as 2019, but it was very competitive with 2019 and the past few months. So this is essentially reflecting August sales. So we're 2 months behind. So and typically the last quarter of the year is our strongest. Of course, we don't get our Christmas money till 22, usually that February. Those are usually our highest. January and February typically are the highest. But I think we've been 7 months over $1 million in our 1% tax, and so that's something we haven't achieved in a long time. I think even in 19 we only had 4 months over that category. So it's definitely a positive sign. Probably the bigger aspect of that is somewhat of a new phenomenon. In 20, the legislature approved, or the governor actually approved, and the Secretary of Revenue for more online sales tax collection. And so that's really been the game changer, because before that, we were in a good month, we get about 150, and we're almost 400,000 a month now in that category. So that's been a big one. It's leveled the playing field, kept things more substantial. The legislature took more action on that this past year to require a lot of so for example, Amazon would have to provide their sales online, but they offered a platform for other businesses to make sales through them that weren't requiring to be required. That little component was fixed by the legislature, so I think that's helped a lot. And certainly a lot of people, one of my concerns was that people got used to shopping online during COVID, and they weren't going to re-engage with our business community. And thankfully, that's a trend that hasn't happened, but that I think they're doing both, which is good. So, but certainly it's not as, I'm very optimistic that trend's going to continue.
Ron, this is Dennis. I have a question.
Sure.
On the $1 million threshold that you discussed, that you've seen so far, any sense that increase has anything to do with the inflationary increase in the price of things that's also driving up the collection of tax revenue?
Yeah, that one's really a little harder to quantify, because we don't get the data of, per sales or anything like that. It's just groupings of types of sales. So I don't know, that'd be something probably to try and glean down, and Gina may have a comment just in visiting with her retailers about, I'm not sure we've seen a lot of those retail component increase prices, as opposed to where we will start to see some of those as shortages developed. And clearly the construction industry has seen that component, but that's not a big part of that retail sales figure that we track.
Dennis, just from we buy a lot of product, a lot of really different things. I don't know if the price increases have been so substantial as not available. Even to purchase food for the hospital, it's pretty typical now that we don't get 15% of our order. And that's probably the more the challenge, is just actual availability of products. And there's a lot of stuff now that's on allocation, different medications, different medical supplies, or you're only getting allocated, or it's now being allocated through the state or KDHE versus the distributors, just because they're trying to manage the quantities. That tends to be, I think, more of the difficulty for, at least for in our industry.
Yeah, we see similar things, Bob. Vehicle repairs. We had to get a pair of brake rotors from Alaska a few months ago because we couldn't find any in the lower 48, for example. We had one of our food vendors, just like the school district did, drop us, but they've recently come back, reapproached us about continuing or restarting the service they are providing to us. But again, my question really just because the collections were consistently higher than what they were in 2019 over that $1 million. I was just curious if inflation had anything to do with it, but Ron answered my question. More to come, hopefully. Thanks.
Can I just add something? I can't speak to the inflation piece, but I would like to add that as far as retailers and small business retailers in particular here and across the country, obviously are also having problems getting product that they normally would sell into their stores. But secondarily here, because of the property tax increase and the combination of property taxes going up and lots of office space being vacated to remote working, you're going to see that the businesses, the retailers and the restaurants are likely going to increase their prices because their property owners are going to have to try to collect their taxes from somewhere. So it's this sort of cyclical thing that's occurring right now that's going to be difficult in the next year, 2 years probably.
Ron, I've got a question for you. In terms of sales tax, when you guys set your budgets and make your estimations, do you estimate them high? Do you estimate them conservatively? What's your base formula for coming up with those, I guess? Because I think as we try to figure out how much we're doing and how much we're moving, how we estimate all that at the beginning plays a large role in it too.
Yeah, it does. We're pretty conservative with our sales tax estimates just because it's, currently we are having better cash reserves. Typically that hasn't been the case. So obviously if you shoot high and you don't collect, then the only options you got is to cut in order to make it. So we do purposefully do a little conservative and try to weigh really our historical. We've been trying to really focus on 19 and 20. So, and we really based it. We didn't do too much with the online sales. Now it's not a huge component, but it's been a growing component. So that's helping feed that surplus a little bit. I think right to year to date, I want to say we're around $600,000 more than what we thought we would be at, what we budgeted to be at. Of course, we set that budget during the pandemic last year too. So we were much more conservative last year because of that. But generally we're conservative with sales tax anyway, just because it's just so unpredictable and cyclic.
Yeah, I would probably second that notion on the county side. I may mention in terms of the compensating use, we've kind of segregated those numbers, although we can't, much like the regular retail, go in and specifically look at each particular sale. We've had Shiloh and our treasurer's department kind of separate those so we can start looking at it a little bit separately and kind of see what those trends are. And I think to date, we're somewhere up over like 12.5%. Don't quote me specifically on that, but it's large enough to know that it's a very large component to everything that's happening, everything that has happened, and everything that's probably going to happen in the future. I think one of the concerns that we've talked about here, at least moving forward between now and the end of the year, is, as we get into the holiday season, the retail sector, what are these supply chain issues going to do to that? And it's not just, buying gifts or, buying those things. It's food for Thanksgiving, food for Christmas, the things that need decorations, everything else that everybody typically buys this time of the year. What's the lack of availability going to do to that equation? And I think as we get into 2022 and start seeing those numbers, I think we're going to have to take that approach in mind. And even if it is on the lower side, understand that that's probably one of the major reasons why, not necessarily not people wanting to spend or having the ability to.
Yeah, I would agree. I think the food and fuel are going to be some new issues, certainly, that we'll see some inflationary pressures, no doubt.
The other issue in that regards is workforce. So people are having to pay more to get people in the workforce, which isn't necessarily good or bad. It just is. One of the things that we have started at the chamber through a variety of individuals, as we did our business surveys over the last year, it was clear that childcare was rising up as a major issue, getting people to work. And the numbers show that we have a deficit of about 1,500 to 2,000 spots in Riley County. That doesn't count Pot County, that's just Riley. So we've put together a group of providers, business, HR professionals, and then public officials, including staff from Julie's team, which we appreciate. They had their second meeting yesterday, and they're working on some action strategies for how to increase capacity, just so people can go to work. Because right now, if you need daycare, it's a challenge to even find anybody, regardless of cost. So.
Other items for discussion today?
I have a question. Are we kind of thinking about maybe circling back around on points learned? I guess I just kind of have an inquiry and kind of thought, you know, in what we learned in shutting down, you know, for a month, you know, businesses, the impact, and if we would consider maybe doing things a bit differently. I guess my thought being is that, as I recall one of our discussions, you know, here, you know, Walmart, Target, you know, some of these stores, you know, could be open, but, you know, and not to kind of pinpoint anybody, but I just recall, you know, Manhattan Running Company had to be closed. You know, maybe some of these other, you know, smaller retailers that sold same, you know, items as, you know, Walmart, Target, et cetera, you know, and, you know, maybe that's something that I guess, you know, I kind of wonder what everybody's thought, you know, and opinions are in that. You know, same with, you know, restaurants, you know, I guess every business and, you know, even, you know, city and county, you know, offices. So I hope that I'm not too far out of line, but I'm just kind of, you know, kind of curious what the feedback and, you know, the thoughts may be now on some of the decisions made, you know, in the past and how, you know, we might think about this, doing it differently moving forward, you know, for hopefully some time that we don't have to encounter this again in the future.
Yeah, Kelly, you raise a good point, and not that many meetings ago, we did talk about trying to maybe document some lessons learned and be kind of a report out from the committee. So I haven't talked to Bob and Jason a lot about this, but I still think that's a good idea, whether we send that to the city commission and each of you can take it back to your entities, and whether it's public or private, and certainly should at least document some of what worked and what didn't work, and maybe what wasn't fair and didn't work like we thought it would. And, you know, if we had to do over, would we do the same thing or would we do something different? So I think that would be reasonable for the task force to do.
You know, I think I know Dennis Marshall helped us start drafting one. I don't know, maybe it's not quite a year ago. I think that is kind of a nice way to also kind of wrap up our activity as a group at some point, because I do think that's certainly we're created for purpose, and I've worked through that and tried to be helpful over the last year and a half. But also, I think kind of documenting some of this is key, because there will be sometime that we can still learn from this, some sort of occurrence. So I think it's a great idea to try to do that. And maybe what we can do is just via email over the next month or so, kind of try to collect some of that as a draft, get ideas, and then maybe we don't meet in November, but we meet in December to try to kind of finalize that product, if you will. That way Dennis can still help us before he thinks he's going to go retire somewhere.
And we do have that compilation, and that I was going to suggest we can certainly put that together and add anything that we have since then, and send that out as a draft and circulate it among the task force for folks to either say, yeah, I like that, or no, that's not really what I meant. And I think we should do this. It'll give us something for some good final discussions, I think, to be able to, like you say, maybe come back in December and arrive at a good list of lessons learned.
And I think it'll be important as we look at that to take a look at how the actions that we took and how this community fared compared to other communities in other states. Because It was a very difficult decision for K-State to shut down as fast as it did. And we had to jump through major hoops to make that happen and still deliver an education. But we do firmly believe that stopped a huge outbreak in this county. And we didn't have any major outbreaks on campus at all. We had our quarantine levels up, but the measures we were taking and the outbreaks that happened were not happening on campus. So I think it'll help us to measure what we did, and then how Riley County, how Manhattan, how Pottawatomie County, Geary County, how we fared compared to other counties in the state based on our actions, and how we compared to other states across the country. So, because we did better than quite a few other states and other locations. It was painful for everybody, but I think everybody can be really proud of what we did to try to help people as much as we could and help our healthcare system from imploding, because that was a huge concern. We would have been in a lot of trouble if they had gone completely under like they did in New York and some other places. So that's just a piece that's probably hard to grasp, but I think we need to include that in the final conclusions or observations.
Yeah, well, I would agree. The actions the community took is what saved us. I mean, I think you can ask our medical staff, you can ask our staff. If some of the things that happened in 2020 hadn't occurred, we probably wouldn't have had some of the outcomes that we've had, which have been good. So certainly appreciative of that. And I also think we've learned a lot too. Obviously time and experience is how you create wisdom. So it's been good. Well, we'll follow Ron's lead on that over the next few weeks. Since we're kind of meeting late in October, that's why I'm thinking maybe we would push into early December before the holidays. So maybe if we're going to do a follow-up call and not try to do that before Thanksgiving. So I don't know that we've really got time to get that scheduled. So if that works for you guys, I'll work with Jason and Ron, and we'll go either, I don't know, first, second Thursday of December, try to get us calendared again, and we'll be ready to roll. Is there anything else before we close out today?
So Bob, in that, that's going to encompass, Fort Riley as well, correct? Yeah. Okay. Yeah. And some of the surrounding communities as well. Yeah. Okay. Thank you.
Anything else, Jason?
I think that's it.
Cool. Well, thank you very much, guys.
Thank you, everybody.
We will be in touch via email.
Everybody have a safe and happy Thanksgiving this year as well.
Yes.
Thanks all.
Bye, everyone.